So coming to the functional anatomy of heart, this is the basic diagram that we are going to see through the entire lectures. So I'll just give a brief introduction of what are all the parts. So on this will be our right side. This is our right atrium and this will be our left atrium. Followed by that in the ventricles, we have the right ventricle and the left ventricle. So these are the four chambers of the heart and this will be our simplistic diagram which is representing the chambers of the heart. Now coming to the valves, we have to know the valves also. Which is the valve which is present between right atrium and right ventricle? It is called as the tricuspid valve. This valve is called as tricuspid valve. Tricuspid valve. This is just a revision because we will be constantly using these terms again and again. So between the left atrium and left ventricle, we have the mitral valve. Here we have the mitral valve. And from the right ventricle, the pulmonary artery leaves and there is a valve there also. From the right ventricle, it is leaving. What is this valve called as? It is called as the pulmonary valve. And what is the valve which leaves from the left ventricle to the aorta? It is called as aortic valve. Aortic valve. These are our basics which we will be using it again and again. And both pulmonary valve and aortic valve, they are together called as semi-lunar valve because they look like a half moon. So that's why it is called as semi-lunar valves. Now getting into the topic, what is the musculature of the heart or the functional anatomy of the heart? The functional anatomy of the heart, the musculature of the heart is divided into two sections. One is the proper myocardium. This myocardial things we have discussed along with the skeletal muscles and smooth muscles also. Along with them we have discussed there. And second one is, which is more important for us, is the modified myocardium. So coming to the myocardium, myocardium proper is the muscle of the heart and it has one important thing which is called as gap junctions. And this gap junctions will transmit the impulse very fast and that's why the atrium can act as a syncytium and the ventricle can act as a syncytium. What is syncytium? The ability to contract together. All the atrium will contract together, also all parts of the ventricle will contract together so that the efficiency can be increased. And it is possible only with the help of these gap junctions because they are transmitting the impulses very fast. And what is the subunit of gap junctions? It is made up of connexons. The protein here is connexons. But coming to the most important part, that is the modified myocardium. Modified myocardium is nothing but our conduction system of the heart. How the heart is conducting the impulses from SA node to the periphery. So coming to the conduction system of the heart, the conduction system of the heart, it is not going to contract. The contracting ability, we don't need it. So it will have very less of actin and myosin. The actin and myosin is very, very less. And it lacks the organelles also. The organelles are also very, very less. But what is so special about it? It has a very specific cell called as the P cells. This is the cells which is present in the region of this conducting system. What does this P term indicate? All of us know it is the pacemaker cells. It is nothing but the pacemaker cells. So this pacemaker cells, what is the ability of this pacemaker cells? Their ability is to produce spontaneous rhythm. Their ability is to produce spontaneous, it doesn't need any external stimuli, spontaneous rhythm. That's why they are called as pacemaker. They work on their own. Whenever we implant it, it is called external pacemakers. If you ask me, in the conduction system, can everybody produce the impulses, their own impulses? The answer is yes. We always say it is the SA node, but other nodes also can produce the impulses on their own. Since the SA node is dominant, it is producing the maximum impulses. It is controlling the other part of the heart, which we will see what is the reason behind it. So first coming to the elements in the conduction system, the most important one is the first starting point, that is the SA node. It is present in the right atrium where the superior vena cava comes and joins. So this is our SA node. From the SA node, 3 internodal fibers go and they will go to the AV node. They will go to the AV node. This internodal fibers are anterior, middle and posterior. Anterior, middle and posterior. Anterior group is called as Bachmann. Bachmann group of fibers. A followed by B. Anterior is Bachmann. Then middle is M. Reverse of M is W. Wenckebach. These are Wenckebach fibers. And finally the P, that is the posterior fibers, are carried by Thorel. So these are the 3 named fibers which will go from the SA node to the AV node. From the AV node, it will be carried by the bundle of His. Bundle of His. Then finally, it will be carried by the Purkinje fibers. Purkinje fibers. So this is the entire conduction system of the heart. Then coming to the automaticity, I told you all of them can produce the fibers like beats on their own. But we have to know what is the exact rate of their conduction. The SA node can conduct at the rate of 60 to 80 beats per minute. I am writing it in beats per minute. Then coming to the AV node, it is a little less. It can conduct at the speed of 40 to 60 beats per minute. The bundle of His is also very similar. It can also conduct at the 40 to 60 beats per minute. It can produce or generate impulse from 40 to 60. Then finally coming to the Purkinje, which is the least, it can produce impulses from 20 to 40 beats per minute. Purkinje fibers or the ventricular myocardium, they themselves can produce their own automatic rhythm at the rate of this much. Then coming to the conduction velocity, this is not the conduction rate that it is producing, automaticity. Here we are talking about the conduction velocity with which the fibers are conducting the current. It is very surprising that the SA node and AV node are least in that, because they are supplying very less area, whereas the Purkinje has to supply all of the myocardium at the same time. So that is the reason why this Purkinje will have the maximum amount of conduction velocity, speed of velocity. So coming to the velocity, it is 0.05 in case of an SA node. Then followed by that, the AV node is 0.02 to 0.05. The AV node has the very slowest conduction within themselves, and there is one physiological importance also which we will discuss. Then coming to the bundle of His, it is having the velocity of around 1 meter per second. It is 1 meter per second. 1 meter is good, fast enough, but Purkinje, they have to charge all the ventricular myocytes at the same time. Then only we can act it like a syncytium. So it is carrying at the speed of 4 meter per second. It is very, very fast. So these are the conduction velocities of the individual conduction system. Now coming to the question, that is why SA node is very dominant. We always say SA node is a pacemaker, SA node is a pacemaker. Others also have the pacemaker cells, but this SA node is the dominant one. So the reason behind is the SA node fires at the maximum rate. Fires at the maximum rate. And let's try to understand with a simple example. Suppose if there is a car which is pulling maybe an auto, we'll write it a name, the car, auto is there, then finally a bike is there behind it, or a cycle. We can take a cycle since the bike also is faster than cycle. So what will happen when all of them are attached? What is going to happen? Whatever the speed the car is moving, it is going to move at the same speed. The rest, because they are attached now, whatever speed the car is moving, ultimately the auto and the cycle also can be pulled at the same speed. At the same time, if the car is not there, suppose if the SA node is stopped, then and there only the auto will take into control and it will be generating its own speed, maybe say 40 to 60 kilometers per hour. Then if the auto is also damaged, like if the auto is also cut from the chain, then even the cycle has its own speed, like maybe a 10 to 20 kilometers to 30 kilometers through which it can be moving through. But whenever all of them are attached, the dominant person will suppress the other impulses, because whenever they try to fire, even before they try to fire, the another impulse will be coming from the dominant person. This type of suppressing the other people, which is done by the SA node, is called as overdrive suppression, because it is driving at a higher speed. This phenomena is called as overdrive suppression. This phenomena is called as overdrive suppression. And that is the reason why SA node is a dominant pacemaker. And the RMP of SA node is more towards the positivity. The RMP is more towards the positivity, we can say, so that it easily gets excited. And there are special type of channels which is present in the SA node, so that they can keep on firing on their own higher rates. So these are the reasons for the SA node becoming the dominant pacemaker. And coming to the conduction time, so from the SA node, it takes some time to reach the AV node, and the duration for that is 30 milliseconds. And in the the AV node does not directly conduct to the bundle of His. The AV node is like a gatekeeper. What it does is, there is some delay. There is 90 millisecond delay. Inside the AV node, there is a delay which is happening for 90 milliseconds. What is the use of it? What is the physiological use of it? So what happens is, if the fibers are firing and the AV node it is reaching, in the AV node they are staying for a longer time. So what will happen by this time? The entire atrium would have been depolarized and there will be an atrial contraction. Now after the atrial contraction only, the ventricles can be filled properly with blood, and the ventricle will have adequate blood. If the ventricle is also contracting at the same time, is there any use? It will not be any use because the valve is open and ventricle is also contracting, atrium is also contracting. So what happens is the AV node stops the impulse for some time so that adequate filling of the ventricle can happen. Two things can happen. So first thing is atria acts as a primer pump, It starts the functioning of the heart. So it pumps all the blood to the ventricle, and then second thing is adequate filling can happen. Adequate filling of ventricles can happen. So this AV nodal delay is very important and essential for separating out the atrial syncytium and the ventricular syncytium. Adequate filling of the ventricles can happen. Then finally, from the ventricles, it will take around 40 milliseconds to reach the bundle of his. From there, the entire conduction is going to happen. So what is the total duration taken to reach the ventricles? All three are the total duration to reach the ventricles, which is around 160 to 170 milliseconds. Once it reaches the ventricle, within a short span of time, within 50 milliseconds, the entire ventricle can be depolarized. And that is the ability of Purkinje fibers, because they can conduct at a very fast rate. And within 220 milliseconds, what is going to happen? The entire ventricle can be depolarized very nicely. So coming to the